Hello, my name is Robert Busey. Today I'm going to be performing a head-to-toe assessment for evaluation of MUW course NU 361. My volunteer, just want to explain to her that all the information gathered in an assessment is confidential and she has the right to refuse the assessment at any time. So we're just going to start by generally inspection of the face and head, skin tone, symmetry, everything looks good. Light palpation to see if there's any pain or tenderness. Don't feel any lumps or indentations. No pain. We're going to go straight to palpating the temporal arteries. Both are equal and strong bilaterally. I'm going to move down to the TMJ. Just going to get you to slowly open and close. Okay. No clicking, popping, any tenderness?
No.
I'm going to get you to clench your teeth, and I'm going to hold, I'm going to pull down just a little bit. Just hold that clench against resistance. Okay. Good. Okay. And going to check further cranial nerve 5. Just tell me when you feel this. It's a little cotton wisp.
I feel it. Feel it.
Okay, good. I'm going to have the patient today do a Snelling eye chart. So we're going to just pop up, and the chart's here. It's a 10-foot chart. I'm going to get you to cover one eye and read the lowest line possible.
FELOPZD.
So that's line 7. Okay, do you have the other one?
EDFCZP.
Okay, so that's line 6. So right eye, she's 20/40, and left eye 20/32. Again, that's from 10 feet. Okay, sit down, please. Just going to test for the 6 cardinal fields of vision. I'm going to check for conjugate gaze. Just make sure you can follow. Don't move your head. Just follow my fingers. Okay, gaze is conjugate, no problems. We're going to assess the pupils. So I'm going to look for, again, accommodation. Pupils already are not overtly dilated or constricted. As I shine the light in the left eye, the right eye did constrict, as well as the left. And again, so accommodation is good. I see no signs of yellowing or redness in the sclera. Conjunctiva is nice and pink, no tear duct swelling, eyebrows, normal hair distribution, lashes. You can close your eyes gently. Lids are fine, okay. Corneas are nice and clear, irises are blue, and some green. So I'm going to look at the ears. So just start with general inspection. I see no swelling. I see no abnormal drainage, no drainage of any type. Just going to lightly palpate for any tenderness. Okay, so really no signs of otitis media or anything. We're going to perform a whisper test. So what I'm going to do is occlude your left ear and whisper a word over here, and you tell me what it is.
Apple.
Okay.
Baseball.
Okay, we want to use the 2-syllable words, it's easier to understand. I'm going to check the nose. Basically, start with inspection. I see no drainage, I see no swelling, everything's nice and symmetrical on the bridge. So you can just kind of hold one nostril closed and just sniff. Okay, and the other. Okay, good, patency is fine. I'm gonna take a look at your mouth first with out of tongue pressure, just to look at all the mucous membranes. Say ah. That's ah. So the buccal membranes are moist, pink, floor. The hard palate, soft palate, no ulcerations. Tongue, no white patchiness, no sign of redness or swelling anywhere. Floor, fine, no dental caries, no decay. Gum lines are fine, no swelling, no bleeding. So one more time. Okay. So the uvula did rise, good mobility, especially just over tonsils. The protruding just enough to see, no white patches, no redness or swelling there, no problems. One more thing, just stick your tongue straight out at me. I want to check for symmetry. Good, okay, everything is fine there. I'm going to move into palpating the lymph nodes. So I'm just going to use the pads of my index and ring finger, gently palpating a circular motion. I'm going to start with the pre-auricular, post-auricular, occipitals, the submandibular, and go back to the tonsillar, submental, to the posterior cervical, and the supraclavicular. Alright, so none of her lymph nodes are outstandingly palpable. They're all discrete. If you were to find anything hard or immovable, that's a big cause for further workup. Was there any tenderness when I did that?
No.
Okay. I'm going to check the frontal sinuses and maxillary sinuses. So we're going to look at the maxillary and the frontal. Pain or tenderness on that?
No.
Okay. Again, no general edema noted in the orbital areas or sinuses. Okay. I'm going to test cranial nerve 11, which means I want you to check your neck motor function. Just kind of point your chin to your chest. Good. And see if you can go backwards. Okay. Good. And just turn your head left and right. Okay. And your left ear to your left shoulder. Good. And the other one. Okay. Good. Okay. For this, I'm going to give you some water. Check the trachea, throat, midline. Everything's midline, nothing side to side. No visible goiters, swelling, anything like that. So I'm going to come back and locate the trachea. This first, second ring of trachea. The thyroid should be spongy, pretty much move from side to side freely. I'm going to go ahead and get you to swallow. Any tenderness in there?
No.
Okay. Once you swallowed it, the thyroid moved up and down through my fingers. I'm going to check your carotid pulses. First, I'm going to lightly palpate, one at a time. Both equal strong bilateral. So I'm going to listen to those with the bell of my stethoscope, and that's going to be just checking for any bruise, any swishing sounds, which could indicate some sort of stenosis. And those are not noted. Nice and clear. I'm going to go ahead and get you to turn around. I'm going to check your back. Okay. Just kind of pull your tank top up your shoulders. Okay. So first we just again inspect. No skin abnormalities, no lumps or indentations of any sort, bruising. Everything looks fine. So just going to lightly palpate, asking for any pain or tenderness along the way. And we'll feel any lumps, anything abnormal. The next thing I want to do is get my reflex hammer, and I'm going to go ahead and percuss lung sounds. I want to hear a slightly tympanic resonance. Any dullness would maybe indicate fluid consolidation or masses. So I'm just going to percuss using my index and middle finger with the reflex hammer. All seems resonant. I'm going to check for tactile fremitus, so I'm going to ask the patient to repeat the phrase 99 as I palpate gently with the palmar aspects. Say 99.
99.
Okay.
99.
Okay.
99.
One more.
99.
Okay. So I felt equal, symmetrical fremitus throughout. So that's good. So now I'm just going to take the diaphragm, my stethoscope, and listen to breath sounds. Okay, so good air movement, clear, no wheezes, no coarseness, anything like that. Sounds good. I'm going to check the costovertebral angle. I'm going to lightly percuss, basically to see if there's any kidney renal tenderness. Okay. No tenderness?
No.
Okay. You can put your shirt down from there. So I'm going to go ahead and inspect and palpate the upper extremities. I'm just going to hold that out. No obvious bony protrusions. Everything looks fine. No edema. Again, over here, everything looks good. Okay, so I'm going to start by palpating the pulses. I'm going to do the brachial pulses. Yeah. Good. And the radial. And ulnar. So this is equal and strong bilateral. I'm going to take my reflex hammer. Well, actually first, let's do range of motion. So what I want you to do, kind of hold your arms above your head, okay, and then behind you, okay, and then kind of abducted and abduct and back. Right, while you're there, go ahead and touch your finger to your nose, okay, just like the end of them. Okay, good, okay. Now hold your arms straight out in front of you. We're going to test your elbows, so just kind of flex your elbow and just both at one time, that's fine. Good, okay, and we're going to do that with resistance. Okay, and push, okay. Strong against resistance, equal bilaterally. I'm going to check your wrist, so kind of just roll your wrist back and forth. Okay, and good, and touch each finger one hand at a time to your thumb. Good. Good. Okay. Good. Okay. All right. So now we can take some tendon reflexes. So first I'm going to check the triceps. So just kind of dangle that arm nice and loose. We should see just a small amount of extension. It did. Okay. Brachial, just above the antecubital, should be just a slight amount of flexion. Oh, there we go. Okay. And we're going to do the ulnar, or excuse me, radial, and this should elicit just a small flexion of the thumb. I can find it, right? There we go. Just a little bit, not much. All right, we're gonna do the same thing on the left side, just kind of dangle the arm down. Okay, good. Okay, good. Yeah, good. And radial on the left. There we go. Slight, okay. No hyper reflexivity. Okay, go ahead and get you to lie down on the couch, please. Just kind of pull your shirt up a little. Okay, so what I'm going to do is inspect for work of breathing, which can change in supine position. Ours seems to be fine. I see a flat abdomen, no excessive bulging or concave activity. All right, so I'm going to start by palpating the precordium over the point of maximal impulse, which is the fifth intercostal space on the left midclavicular line. With the palmar aspect. Okay. All right. So what I'm going to do now is listen to the heart sounds, beginning with the aorta, moving over to the pulmonic, and then down to the tricuspid and point of maximal impulse, mitral. So first with the diaphragm, the second right intercostal space for the aortic, left second intercostal, the pulmonic, fourth on the left, it's the tricuspid, and fifth midclavicular. Okay, we'll switch to the bell. This is to see if there are any murmurs or swooshing, low pitch sounds. Which there are none. Okay. So I heard a regular rhythm, S1, S2, no extra heart sounds, no murmurs noted. So we move down to the abdomen. First we inspect again, again, no abnormalities. I don't see any pulsations, no visible peristalsis. So what I'm going to do is begin to listen to the bowel sounds. I'm going to start with the diaphragm. Do you have any pain or tenderness in your abdomen?
No.
Starting in lower right quadrant up to the upper right. Upper left, lower left. Bowel sounds, normal, active. I'm going to listen slightly above the umbilicus with the bell. I hear no swishing of the aorta. I'm going to move over to the left for the renal artery. Move back to the right for the other renal artery. Just no swishing, no bruise noted. So next thing to do is to percuss. So I'm just going to lightly percuss each quadrant. I want to hear slightly resonant sound again. It should be mostly fluid in air. Okay, and they are resonant. Light palpation is next. Just tell me if there's any pain or tenderness. Just to see if there's any masses. Nothing notable. So we're going to do deep palpation, a little bit deeper, and I'm going to release pretty quickly to see if there's any rebound pain. Okay. Anything?
No.
Good. Next, just palpate the liver. It should not be palpable. Maybe on small children or small people, children, unless there's an abnormality such as hepatomegaly. Just kind of get just under the bottom of the rib cage. It's just a lot of muscle tone. So there's no liver noted there. I'm going to move to the lower extremities. I'm just going to start by inspection again. I don't see any abnormalities noted. Everything looks symmetrical, no edema noted. Skin tone looks fine. No cyanosis on the feet. I'm going to check for popliteal pulses. Okay, equal and strong. We're going to check for the posterior tibial. Equal and strong. And the dorsalis pedis. Equal and strong. Just light palpation. No edema noted. I'm going to get you to flex your toes up towards you and back towards me. Okay, we're going to do that with resistance. Okay, good. No problems noted. I'm going to check for Babinski reflex. What you don't want to see is toes fanning upward and outward. That could show some neurological deficits. If anything, a slight plantar flexion. Okay. Slight plantar flexion at that time. Okay. All right. If you will, we'll just get back on the stool. What I'm going to do first is check for the patellar reflex. Good. Check for the Achilles. To test some cerebellar function, I'm going to get you to take your right heel and move to your left knee and just kind of rake it down to your ankle. Good. And the other. Okay. Good. Okay, I'm going to get you to stand up. Just kind of close your eyes and stand still. This is Romberg test. Should be able to maintain posture without any problems. She does. That's good. Okay. I'm going to get you to walk 4 steps on your heels that direction. She does so well. And back on your toes, please. Excellent. Okay. Hop on one leg one time. Good, and the other. Okay.